Is there a definitive early diagnostic tool for dementia? Imagine trying to catch a tiny spark before it turns into a blazing fire. That's what early diagnosis of dementia aims to do. But right now, there is no single test that can definitively say someone has dementia at an early stage. Instead, doctors use a mix of methods to piece together the puzzle. These include cognitive assessments, brain imaging, blood tests for biological markers, and thorough clinical evaluations. The most common way to spot early signs is through face-to-face cognitive tests. These are carefully designed tasks that check memory, thinking skills, and problem-solving abilities. They are considered the gold standard because they help identify mild cognitive impairment or early dementia during routine doctor visits. Recently, digital tools like quick tablet-based tests are gaining attention. They can be used in primary care settings to screen patients more easily and quickly, helping catch issues sooner. Technology is also playing a bigger role. Artificial intelligence is being used to analyze brain scans more accurately. AI can spot patterns in brain images that might be linked to different types of dementia, making diagnosis faster and more precise. This is promising because it can help doctors distinguish between various forms of dementia, which can sometimes look similar in early stages. Blood-based biomarkers are another exciting development. These are tests that look for specific biological markers in blood samples linked to Alzheimer's disease and other dementias. Blood tests are less invasive than brain scans or lumbar punctures and could become more accessible in the future. However, they are still being studied and are not yet fully validated for widespread use. When used, these blood tests are always interpreted alongside cognitive assessments and clinical observations. Because dementia involves complex changes in the brain, no single test can capture everything. The best approach today combines cognitive testing, brain imaging, blood biomarkers, and detailed clinical evaluations. This multimodal strategy improves early detection and helps doctors make more accurate diagnoses. Researchers are continually working to refine these tools and develop new ones, aiming for earlier and more precise diagnosis in the future. For now, if you or a loved one notice memory or thinking changes, consulting a healthcare professional is the best step to take. They can guide you through the current options and help determine the most appropriate assessments for your situation.